Hi everyone, my name is Dr. Deepak and today we're going to talk about another important aspect that is often not taken very seriously, which is the relationship between women's health and oral health. So generally women's health is divided into three phases, or women's health is divided into three parts of their life. First part is on puberty. Second half is during the pregnancy, and finally it is during menopause. So at each point in a woman's life, you have changes that affect the oral cavity. Okay, so as a dentist, we're going to look at different aspects in each of these different time frames for a woman and how it affects the oral health. So what is important things that you have to do when your child or you go through these different phases as far as a woman is concerned. So the first phase is puberty, which is generally seen from 11 to 14 years of age. So the oral changes that you will see as far as puberty is concerned is generally there'll be an increase in a particular type of bacteria called as Prevotella intermedia. So what happens because of this type of bacteria? Generally the child will have continuous bleeding in the gums. So this is also increased because of malocclusion, which is nothing but the malalignment of teeth. So as a parent, as a mother or as a father, it is very important to notice your child's health during puberty. They will complain of increased bleeding, which can be present because of also hormonal imbalance that is taking care inside a woman's body at this particular point of time. So what you can do at home, give her a soft brush, change the toothpaste if necessary, visit your dentist if the bleeding is prolonged, and also take care of her dental health, which is very, very important at this point of time. This is again a phase. And once the puberty phase is complete, the oral health will be generally restored. There's nothing to worry about as a parent in this particular phase. The next phase of life of a woman's health is pregnancy. So during pregnancy, again, as we all know, in India, it's a very huge thing. Women are generally fed a lot of food at this point of time, but the oral health generally takes a back seat at this particular point of time. So generally during pregnancy, again, due to hormonal imbalance, you have an increase in the size of the gums. The common features that you would see during pregnancy is something called as pregnancy gingivitis, which is inflammation of the gums, which can cause bleeding, spontaneous bleeding. There can be pregnancy enlargement, which I'll again be showing you in a particular slide. You can have an enlargement or a solitary growth that is present on the surface of the gingiva. You can also have an increase in dental caries, which is nothing but decayed tooth, and also tooth erosion because of continuous vomiting. So the first condition we're going to look at is something called as a pyogenic granuloma or a gingival enlargement. So this type of enlargement is generally present in the upper teeth in the front portion of the oral cavity. Okay, so this is a small lesion or a small growth. Generally, it is not anything that we should worry about. It's a non-benign tumor. It's generally present in the upper front teeth of the woman. So this is again because of poor oral hygiene, and because of increase in hormonal imbalance that happens at this particular point of time. So what can we do to prevent it? So once a woman is planning to get pregnant or is then pregnant, you can always go to your dentist and ask for the changes that we have to do or modify as far as our oral health is concerned. Okay, so if you are planning to get pregnant, please go ahead and meet your dentist. They may do a scaling, remove any chances that you can get dental caries during the course of pregnancy. Okay, so what happens if you get this enlargement during the pregnancy? Again, there's nothing to worry about. Like I said, it is a benign condition, and along with your pregnancy, at the end of your pregnancy, it would tend to wind away. However, if this lesion starts to become bigger or you have difficulty in biting and chewing, please always come to your dentist and we can always rectify it at a very early stage. Please do not try using a pin or try to remove these sort of things at home. Okay. So this is one condition that you will very commonly see, like I said, in the upper front region. So why does this generally occur? This is again because of poor oral hygiene or not taking care of the oral hygiene during the pregnancy. And it can also be present because of changes in the woman's body. There are various immunological changes, hormonal changes, and this affects the oral microbiome or the microorganisms that are present inside the oral cavity. Once this happens over a period of time, you will see that there is enlargement in the gums or increase in the size of the gums, and along with that you will have a swelling. Like I said, this is not a malignant condition. This is a benign condition which can be easily managed if you go to the dentist at this particular point of time. Oral health is also important during the course of pregnancy because microorganisms from the oral cavity can also enter into the fetus and can also affect the child. So sometimes a mother can have a preterm rupture, which can then cause a preterm child also. This is a dangerous condition. So this is something we look forward to, especially if the mother has a very poor oral hygiene. So oral health during pregnancy is very important. It is not only the mother's job, but also the father's job to take care of the mother's oral health, because not one life, but 2 lives are at stake during the course of a pregnancy. If you have to go to a dentist during the course of a pregnancy, again, do not bother. Most dentists are very well trained in managing a pregnant woman. Okay? So remember that during pregnancy, the chair side time has to be reduced. We can't give very strong medicine during the course of a pregnancy. However, we can give a lot of palliative care, a lot of counseling can be given for you to help improve your oral health at this particular point of time. Generally, during pregnancy in India, a lot of women are fed a lot of sweets and a lot of nutritious food, but they tend to forget to brush at night. So however difficult you feel, always do brush at night, even towards the end of the pregnancy, because gum disease or dental caries that comes during pregnancy becomes very tough to treat for both the dentist as well as for the mothers. This is something that you have to worry about. The other thing that you also have to worry about during pregnancy is dental caries. Like I said, the ignorance of not brushing at night can cause increase in dental caries over the night time. So like I was telling in the first part of my presentation, night brushing becomes very, very important. So please do remind to brush your teeth at night, or also use a mouthwash during the course of your pregnancy. The last part of a woman's life is menopause. So menopause generally occurs in women about 45 to 50 years of age. So if a woman lives about 80 years, you generally have about 40% of her life that is spent in menopause. So there are a lot of changes that generally occurs during menopause, like xerostomia, which is the dryness of the oral cavity. They have less saliva secretion. And also there are a lot of changes that happen inside the oral cavity, as you see in this particular slide. One common feature that you would see in this particular condition is the thinning of the gingiva. So the gingiva generally remains thick throughout your life, but however, as you become older, the gingiva tends to become a lot thinner. Why is this important? Along with time, what happens is there is seepage of bacteria that happens through the gingiva, and this can affect the tooth or the root surface. So gingiva is the first line, or the gums is the first line of defense that you have to prevent any sort of microbial infection. But this stops with time as the gingiva becomes thinner, and you have seepage of microorganisms inside the gingival surface, which can then cause further gum disease or periodontal breakdown. The other common problem, as you can see in this particular slide, is the exposure of the root surface. So this is called as gingival recession. Because of thinning of the gums, you have the exposure of the root surface, which is nothing but gingival recession. So this can again cause the tooth to look a lot longer, and you can also have some amount of root caries. The caries that generally forms in the tooth surface is formed on the root surface. So this can also be a particular problem. Okay, so you will notice that the gums become thinner and the roots also become longer. So this is also changes that affect inside the oral cavity. So again, at menopause, it's very important to meet your dentist. Be gentle with your oral hygiene techniques during your menopause time. Use a soft brush or an ultra soft brush also at this particular time is fine. See that you meet your dentist very regularly at this particular point of time, because the changes will happen a lot more quicker inside the oral cavity than other periods in the other periods of your life. The other conditions that we are also seeing in women patients, especially after they attain menopause, is a reduction in vitamin D levels, and also a condition called as osteoporosis. So osteoporosis is nothing but the weakening of the bones. So this is also a condition that affects the mandible as well as the maxilla or the upper and lower jaw bones. So why is this a problem? If you want to place a dental implant after menopause, generally what will happen is your bone density will become very, very weak, and therefore it becomes impossible to place a dental implant inside the oral cavity. So as far as menopause is concerned, take care of your oral health, visit your dentist very frequently, and also see that you use an extra soft brush or brush with very soft bristles so that you don't cause damage. Brush with vertical strokes, and don't use very abrasive toothpaste or any mouthwashes inside the oral cavity. So these 3 phases of a woman's health are very, very important. Like I said, puberty is a very natural stage that a woman would go through. It's important that she gets proper counseling and guidance from her parents as well as her dentist. Remember, there will be other things that are associated with puberty, like malocclusion of the teeth. okay, or the patient can be going through other things also. So it's very important to maintain hygiene at this particular point of time. Pregnancy, like we all know, is a very important phase. So treatment generally during pregnancy is advised during the second trimester of the pregnancy, which is the safest period to undergo any sort of dental treatment if you are doing it. But however, it's better to prevent any sort of infection that occurs during pregnancy by getting a checkup before you are planning for a pregnancy itself. So that is very, very important. The last phase of a woman's health is during menopause. So anywhere after 45 years of age, again, there are a lot of changes that occur inside the oral cavity, like thinning of the oral epithelium or thinning of the gingiva. So this can indirectly cause an effect on the surface of the gingiva and can cause or can increase the amount of gum disease that is generally present. So please keep this in mind. If you are a woman or if you know people who are going through each phase of this in their particular health, please ask them to go and meet a dentist, because we are also responsible for your oral health. Thank you so much.